little knowledge of what was going on. But we were contacted on the first day of lockdown in March the 23rd, I think it was. And 2 days later, our lab shut down, as in we weren't allowed to do any research, our existing research. But we were contacted by a doctor at Western Health, an ICU physician and anaesthetist, Forbes McGain. And he said to us, we need to protect our healthcare workers. There's not much other than the PPE that's being proposed, there's not much else to protect them. And our lab was shut down. So my hands-on researchers, all experimentalists, technician, had no other way. So we pivoted to do this. And the world was going crazy. This is at a time where things in Italy were going crazy. We saw that the hospitals were overwhelmed, and it looked very scary. And when I went into the hospital in Footscray, the nurses and stuff were so frightened. There was no cases at that time in the hospital, but everybody was so scared of what was coming. It felt like there was a war about to come. And they were just so grateful for us being there and wanting to help out. So we were given a brief, which was to come up with something that could contain an infectious patient. And at the time, I literally asked, where are those things from Outbreak? I don't know if you've seen that movie, Outbreak, where they have put everybody in plastic tents, basically, who have Ebola. And there was a bit of laughter, but basically the answer was we don't have anything to contain people other than $300,000 negative pressure rooms, and we have 8 of them. So there was, I was a bit shocked. But we went away and we designed this ventilation hood. Some of you may have seen it. It's like a pram hood, clear plastic hood that goes over a patient and has a duct at the back to suck out the air from around the patient, and very effectively keeps the healthcare worker and the patient separated and the healthcare worker safe. To cut the story short, after that we had to make the thing in large quantities. So first we couldn't sew very well, so we went to Rose Chong Costumes. Rose Chong is a friend of mine, and she sewed the first one but said we can't sew these in large quantities. She put us onto Evan Evans, which was a small company that makes banners and marquees and these kind of, they can sew things. And they were able to make something like 200 of these a week. Then we found a fan company, local Australian company, Westerflex, that manufactures fans right here in Melbourne and puts them in places like this, large buildings. And together, within 10 days, those companies were ready to produce something like 200 units a week. And that was a pretty cool thing to get to within 10 days. On the 11th day, we realized that there's this thing called TGA, and you can't just throw 200 units of some medical device into a hospital. I won't go on with the rest of the story. There was a big process after that, and perhaps we'll talk about it a little bit more as we go.
And to cut a long story short, it's still going today? Units are in hospital?
Oh yeah, so the good news story is that Evan Evans, this small company, took on the license. So it's a fully commercialised, fully TGA approved. You can purchase it medihood.com.au.
I've noticed a couple of good plugs in the first couple of minutes. Off to a good start here already. I'll throw over to Raoul. Your expertise in mental health focuses on trauma. So what do you think the long-term impacts of lockdown, specifically, as we've seen here in Victoria, with the personal stress, the uncertainty, will mean for all of us going forward? What should we expect in the coming years?
Yeah, it's tricky. I think, like everything about the pandemic, it's been really uneven. I think Australia and New Zealand are kind of like a parallel universe almost, compared to where the rest of the world has been. And certainly, I guess the early, scene is comparatively good for us here in Australia. I know that lockdown got a lot of flack around the mental health impacts, but actually, when it comes to trauma, it's probably the fear of the virus that has a larger impact on people's mental health, and so we are much more likely, I think, to see a very big spike in sort of mental health issues in countries that have had the larger outbreaks, rather than places like Australia that have had the lockdowns. Obviously, we weren't unscathed in the aged care sector, and I think younger people in particular have really suffered through lockdown in particular. But I think comparatively, I think we're kind of well off. Having said that, it still resulted in a big spike in demand for services. You know, as an example, there's an organisation called This Way Up that's sort of an online intervention for mental health issues, which does have a kind of self-help kind of arm, run out of St Vincent's in Sydney. They normally have about 5,000 sign-ups per month, but during lockdown they hit, I think, 35 or 40,000. So, you know, big numbers. So I think there's still some uncertainty there, but the big markers are so far reassuring, at least locally.
Fantastic. And I've noticed coming back into the office, especially, you know, for the first couple of weeks, you know, we were going for 3-4 coffees a day. There was just stand-up discussions every hour. People just were loving the novelty of being around each other. I believe you've written a paper recently on some of the challenges of adapting to working from home and things like that. Can you tell us a little bit about that as well?
Sure. I mean, what we found probably was more the lack of challenges. I think, you know, I think if you do it well, even in a clinical setting, it can be enormously effective. And we saw a lot of benefits that we didn't really expect to see. You know, one interesting fact was the fact that, you know, because we'd moved to using an online platform for a lot of our communication, it meant that we were able to respond to sort of quick ideas or questions that people had much more quickly than we normally would. So the kinds of things that would have, you know, taken us a couple of weeks to find a time when everyone's working on the same day to meet and hash out an idea, you know, turned into a quick message going, hey, you know, I think this is a problem. What do you say we do, you know, X, Y, and Z about it? And someone else would chip in with, oh, we tried this 2 years ago and it didn't work because of, you know, whatever. And so within, you know, minutes, sometimes you have a decision that would have taken a long time to make in a public hospital, you know, in 2019, 2018. You know, I think there were a lot of pros. You know, obviously there's, again, returning to that theme of unevenness, there are definitely some folk who really struggle with kind of the online clinical interaction, and obviously you do lose quite a bit of information, and, you know, technology goes awry sometimes. But on the other hand, there's people who, you know, wouldn't have otherwise accessed care that were able to get it now that, you know, didn't have to jump through barriers. And we saw a cancellation rate and our no-show rate drop by 9% year on year, 2019 to 2020, over a 3-month period. So, you know, there was definitely a lot more people getting care.
I guess also there's less places to be if they're all at home as well.
That helped.
I'll ask the next question to Tia. You've been working diligently all through lockdown to get your startup VR Core up and running. Can you please tell us a little bit about VR Core, and what has the experience been of creating a business in the midst of a global pandemic been like?
Yeah, so in terms of VR Core, we sit within the digital therapeutics side of things. Basically, we make clinical tools that help with the treatment of mental illness. So the first tool that we are developing is a virtual reality solution that can be used by psychologists and psychiatrists to help them make their treatment of PTSD or post-traumatic stress disorder more effective. So think of sort of veterans going to see psychologists, and instead of doing the usual kind of exposure therapy that they currently do, which unfortunately doesn't work in 70% of cases, they can use virtual reality, which has been shown in 20 years worth of studies to be really effective and really useful in this realm. So in terms of trying to get this off the ground during a pandemic, it was pretty tough. It was good for the first month. I am a bit of an introvert at heart, so just being at home with the dog was pretty good. Not that I don't like my colleagues or you guys, but it was quite nice. Look, it ended up being super tough. Like, you need to be in these kind of environments to be talking to other individuals, whether they are entrepreneurs, founders, professors, members of the general public. You need to have that conversation to spark creativity, and sometimes that comes from the most random conversation with someone who you've never met before, and it's just that 5-minute chat, and suddenly you have like a new idea for something you could do. And without that, it's really, really hard to have the motivation and the dedication to kind of keep your head down and keep moving. And like, having a startup is really hard. Like, it's so stressful. So it's good to have people around you who can be your cheer squad. And if you are at home, yeah, like Zoom is fine, using Slack and all that kind of stuff right, whatever. But nothing beats just being with somebody and just being able to kind of vent at the end of the day and have them go, yeah, this sucks, let's go and get a drink.
You've spoken about the value of kind of networks and just the random interactions with people. So if anyone in the audience does have any great connections for our panelists tonight, please come up afterwards and introduce yourself. Speaking of being around people, recently you went up and participated in the Antler program. Can you tell us what that was about and what happened there and what did you love about that?
Yeah, sure. So for a bit of context, I've come from a research background. I did my PhD in clinical neuroscience at the Florey Institute, sort of across campus. So I've always been a researcher at heart. I took part in the TRAM programs and started to change my thinking around research, how to commercialise and what a startup is and if I could run a business. And then I got offered a place in the Antler program. Antler is basically an early stage VC, so they specialise in grabbing people when they've just had the idea or they've got the early start of a product, and they basically bring you into a 3-month program and you just do master workshops every single day, and you're just in there for 12 hours a day. You're in there on weekends trying to nut out, do I have a business? How am I going to make it viable? How am I going to commercialize it? So being there was a massive change from being in the academic world. We tend to kind of surround ourselves with like-minded people, so we can have a bit of an echo chamber at times. So going into this program that wasn't academic focused, there were maybe 2 researchers out of 90 in my cohort. Everyone else was just a budding entrepreneur with an idea that they wanted to chase. And so suddenly you're getting other people's ideas and ways of thinking that I was just never saw before. People who are just going to make an app and it's going to be an app for online dating. I have never spent time with people who do things like that. All the people I spend time with are neuroscientists, or they're building things to sort of help people and do stuff. So it was a real challenge to not only just be in the program, but also to be able to kind of, I don't know, I guess you have to swallow a bit of pride and go, hang on, these people are also running startups and they have amazing ideas that I've never been able to fathom before. So yeah, it was a steep learning curve, but it was an excellent experience and I really enjoyed it.
Glad to hear. And for anyone at the university looking a little bit puzzled, the VC is venture capital, not the vice chancellor. And I hear you're sitting on some fantastic news. Are we allowed to share tonight, or is it TBC?
No. Until I've signed on the dotted line.
Stay tuned. There is some fantastic news to come out. I'd like to ask all of the panel my next question, because we can see there's this theme of collaboration that has played a part in all of your journeys that has led to being here tonight. So what do you see as being the collaborations that are missing or that we need more of to cement Melbourne as a leader in research, collaboration and innovation? Is it more external, more internal? Where do we need to connect the dots and have these links?
I might just, jump in here. Personally, we need to be working with more startups. We need to have PhD students who are domain experts working with, tech developers and business-minded individuals to actually see how we can make something in their lab and really quickly commercialize it. Sometimes we do work with major companies, but they're too big and it takes too long to get stuff into the hands of those who need it. So I would strongly recommend and love it if the university were to work a lot more closely with very early stage, mid-stage startups.
Move fast and break things?
Yes, that would be great.
Yeah, sure. I think that's exactly the right theme, and I'd probably also interspace or replace universities with all public sector kind of organizations like hospitals. I remember, I think last year I was talking to a fellow who had an idea around making a smartwatch app that would allow nursing staff to tick off medication at the bedside as a way of reducing medication errors. Now he wasn't working in healthcare, just had this idea, pitched it to an accelerator, got some seed funding, had a little prototype, but thought along this line that I should go out to a hospital and just see how nurses do things, make sure that this is actually a helpful thing to do. And he told me that he called pretty much every public hospital in Victoria he could find, and only one said, yeah, sure, why don't you come, this one day. I'm happy to say that was my employer, the Austin, so good on them. But he very, very quickly realized that they probably needed more batteries on their laptops rather than, a smartwatch, and that, there were Wi-Fi issues and other things that just wouldn't enable an idea like his to succeed. And I think if more public sector organizations were more willing to kind of work with early stage companies rather than going for the Microsofts and IBMs, as much as that there's a space for that, I think that would really help surface ideas more quickly, allow us to commercialize more, and really get innovations where they're needed. And sorry, I might just chip in, actually. I think more formal opportunities for those kinds of things that led to, your venture would really help. All of these stories of, I knew this person, so I gave them a call, etc., depends so much on serendipity. And if we could surface more of the folk that are able to do or contribute in this way, that'd be really helpful.
Yeah, I was going to start off with almost exactly what you said, Raoul. Certainly agree with both our panelists here. And I would more broadly say I think we need to work closer with industry. I found that there was preconceived ideas on both sides. Being inside the university, there's preconceived ideas on both sides of how each other worked and what wouldn't be possible before we even started. And it was quite eye-opening to get together. And when we really had to work fast during the pandemic, that people could see that we both had things to bring to the table. So I think we need to get out there, as you guys say, to say something different. I think that this is a tricky one. We need more multidisciplinary activity, and this is a cliche thing to say. Everybody says this. So I've been fortunate that I've had the opportunity to have a team with virologists, clinicians, electrical engineers, mechanical engineers, hospital engineers, technicians as well. I'm sure I'm forgetting aerosol scientists. It's been an incredible multidisciplinary team. The challenge is to get those teams to work together and get the right people in the room. And again, something like a pandemic can bring those people together in a way that they probably maybe wouldn't have had the patience or the time or the drive to come together with before. So creating those structures, I think that you just said, a formal structure, not only to work with industry, but formal structures that can encourage not just any multidisciplinary team coming together, because anybody can get a bunch of people together and start talking. But to have a team that can really work together, that really has a collective goal, that can really get something done, I think is a real challenge and something that could really benefit us.
So sticking with you, Jason, and the kind of the three key points there were, changes in culture, links to industry, and cross-discipline teams. How do we recreate, I guess, the scenario or the drive we felt during the pandemic going forward to recreate, these situations and ensure that innovation drives as quickly as it has in the last year?
Well, we don't want to recreate everything that happened, that's for sure. I mean, yeah, the environment was one of a crisis. So, we certainly don't want to recreate that. I think what we want to do is remember this crisis. And we don't want to say we got through it because we had a vaccine. So next time something goes wrong, let's just wait for a vaccine. And there was quite a lot of that, I think, that happened the whole way through, certainly politically. We've seen, this is not the first pandemic, as we know. There's been SARS and MERS most recently, and I did a lot of research into what I was trying to develop, devices that could help in the way that ours did. And I found that there were things that were done, but they were forgotten, and nobody was producing these things. So I think it's really important that we don't forget what has happened, that we prepare for something that's potentially more infectious. I hear a lot about this disease is only, the transmission is not that great by aerosols. Well, okay, what if it was twice as transmissible by aerosols? Right. Shouldn't we then be fixing up our hotels? Shouldn't we then be fixing up our building ventilation for the worst case scenario, now that we know what we can do? So I hope that we won't forget. I hope that there will be funding put in and still the drive from both industry and government and the healthcare sector to continue to not just learn from what has happened, but to continue to innovate so that we're ready for the next one.
On that message of funding, so Rahul and Tia, 2020 we saw the largest spike in investment in telehealth I think it was over $14 billion invested into telehealth companies. As two people who have kind of played in that space a little bit, where and how do you see telehealth evolving post-COVID?
Sure. I was actually going to comment on exactly that in relation to what you were saying, because I think one of the things that we really need to see is both government and companies accepting that the world has changed and irreversibly. And one of the issues with telehealth and how it's been progressing has been that the government extensions of the telehealth programs have been very sort of stop-start. So they've said, okay, we're going to continue arrangements for 3 months, and then now it'll be the end of the year. And so it's been in small increments each time, which has meant that even though almost all of particularly mental health care, but also a lot of healthcare in general, transferred to online platforms, a lot of it has already turned back in the last couple of weeks because more and more people need that certainty that this is going to be how we can continue to build Medicare, and we have to start preparing people to go one way or the other. And so those bits of uncertainty, I think, have been difficult. And I think this is also a risk for Australia more generally because having been able to return mostly to normal in a way that a lot of the rest of the world hasn't, they've still got that kind of push to innovate from an external, almost crisis position, whereas we kind of have the luxury of being able to kind of go back to old ways to some extent. So I think that is a danger for us, and we probably have to be mindful of it and try and think about how we can use the advantages that we've got in the room that we've got to move, while still kind of keeping that in mind.
Yeah, and I would just to add to that I mean, telehealth has seen a huge spike in VC funding, but so has mental health in general. In startup land, a lot of mental health startups have been given a lot more money than they've ever seen before. So we know that during the sort of pandemic and during with all the lockdowns and everything, we are well aware that mental health is something we need to protect at all costs. And I think it's kind of brought to the fore what we kind of already knew before, but now people are forced to actually face it and to recognize that this is an issue. In terms of telehealth more specifically, the problem is there's a huge behavior change that's required to have that be the new norm. And I've spoken to a lot of psychologists over the last couple of weeks doing sort of research for the startup, and a lot of them are saying, people are at home, but they've got screaming kids running around, maybe their spouse is coming in and out trying to get them cups of tea, and it's not like a safe clinical environment. It's not a safe space for them to actually share what's going on. And then you've got that issue of, well, are they just kind of coming to the sessions to tick off a box to say, oh yeah, I saw my therapist today, as opposed to doing the real work. So I think there's still quite a long way to go in terms of utilizing technology other than just telehealth to make that sort of remote care more effective. And
in both of your experiences, is the use of telehealth, is that destigmatizing some of these things as well? Is it making it easier, harder, or a bit of both?
Yeah, look, it probably is a bit of both. I think, telehealth makes a lot of sense at either ends of the kind of severity spectrum. At the very severe end, sometimes that just the challenge or the barrier of getting out of your house and going to a clinician is just too much for some people. And then at the other end, maybe you've been battling depression, been out of the workforce for 6 months, 12 months, and are just heading back. And then people find themselves in a situation where it's their first week back and they've got to tell the boss that, hey, I need to leave at 3 p.m. Every second Thursday to battle the traffic and get to my therapist. That's not great either. And that's the moment at which that support of being able to dial in on a lunchtime might make the difference between employment and unemployment. So it makes a lot of sense.
Yeah, I have also heard people say that sort of on the flip side, that if they can jump into a Zoom call with a client and they can see maybe their living room set up. They can see if is it completely filthy, does it look quite clean. They can kind of get some idea of what's going on in their environment. It's a very small window into that, but it is something that they don't usually get. So I think, like, realistically, you need to have like the flexibility. So if somebody's sort of working for like a business and it's too embarrassed to come out and sort of say, well, I need to leave to go and do this, they need to have that option. Whereas for those who need to be in the safe space, that needs to be available as well.
That's a really interesting insight. I always blur my background so you can't see the dirty socks hanging up in the background. On a slightly different note, in less than 24 hours, more Americans will have died of COVID than from combat in all wars since the American Revolution combined. With the rise of so much disinformation, often touted by politicians, both here and in the US and all around the world, how can and should research evolve to communicate with everyone?
So, I would say, I mean, scientists are terrible at communicating, we're awful. And I think we need to get better at that, and we also need to do more stuff to like work with schools, and not just like schools from posh suburbs, but like schools from like areas that have been disenfranchised, low socioeconomic status, where we can actually work with kids so that they can grow up understanding what critical thinking is. And that's something as well, critical thinking, that, I mean, I teach my students about it, and I'm teaching adult psychology students what critical thinking is. It's not something that we are born immediately understanding. So it's something that should be taught, and I don't know if primary school is too early, but definitely by secondary school, and that definitely needs to be across the socioeconomic and class barrier, for sure.
Grassroots approach?
Yeah, I think just on that, I mean, it's a bit away from the theme, but I think education is, or transforming how we educate is so core to this whole innovation, journey, I guess, for Australia. I mean, we stream off so early into thinking ourselves as, the science kid, the business kid, the artsy kid, or whatever, right? And so, I mean, that's part of what I found so valuable about programs like TRAM and another program I did just before, which was really just introducing the basics of, running a business and, transforming an idea into a thing that people can access and buy and use. Whereas I think in the siloed way that we kind of learn, business or commercialization can sometimes almost be a dirty word. You just, there's, and I think that has lingering impacts. Yeah.
I always find this a little bit funny that lecturers or researchers can stand in front of 200 people and present their research or talk to a bunch of students, but then if they have to talk to the public about their work, they go silent. But why is that? That's because we have so much practice at doing those other things, and we don't have much practice at doing things like this. I've certainly been fortunate over the past 9 months to have a lot of interaction with media and these kind of forums, so I can tell you for sure it's practice, and so we need people to be out there getting over that hurdle of I'm introverted and I don't want to talk about this to the public. I guess the fear of non-experts not understanding what you're saying is too big a hurdle to get over. So I think the knowledge that people want to hear about what you're doing, right, and maybe some assistance with how to translate that might help a little bit. But I think really it's just practice. Just get out there and say what you got to say.
Practice and opportunities. Sticking with you, Jason, you mentioned before how valuable it was having the insights and working with the team at Western Health. Can you tell us a little bit about kind of what that and how that directed the project? And secondly, how has this changed your perspective on ensuring your researchers that you're working with are engaging and experiencing problems that they're solving firsthand and with empathy?
Yeah, look, it was huge. Having the team at Western Health, working so closely with the team at Western Health was a huge eye-opener. What we saw when we started looking into who else was developing things for the pandemic, right? This was March 23rd. Everyone was going crazy. Ventilators were the talk of anybody who had a 3D printer was making a ventilator. But what I realised from looking around was that most engineers that were trying to do things didn't have that connection to the hospital. And I think you mentioned, Raoul, before, it's not that easy. Right? You can't just walk into, especially during a pandemic, you can't walk in and say, hey, I've got something you might need. But nevertheless, there was a lot of people working on some great innovations but didn't have the connection to the hospital. So that in many cases, although they were doing great things, wonderfully innovative things, fantastic solutions that might be really cheap, they weren't necessarily the solution to the problem that was most needed. And we realised that very quickly from walking into the hospital. The nurses were very quick to tell us, we don't need this, we don't need that, this is what we need, and nobody's talking about this. So by listening to those people and then constantly going back for feedback, so we developed something. We knew as engineers it worked. It was the right solution. But when a nurse interacted with it, there was an opportunity for it to break in a way that we would never have predicted, because we didn't know what it was that we didn't know that they reached over the patient in that way, or that if there was an emergency, they would need to push it in that direction. These kind of things we only found out from going into the hospital and talking to them. And a lot of them are quite mundane little things, but some of those things led to failures during initial testing. One of the hoods was knocked over, and it was just, for us as engineers, we're standing in the lab going, how could you knock this thing over? So we learned that you had to make the base much stronger. So the little things like that, we really had to interact closely with the hospital. So if we didn't have that interaction, if we were just in a garage trying to produce something and then trying to sell it to a hospital or the government, it never would have happened. So I think working really closely with the market, and this is not just about the hospital. I think you asked about empathy and how I would train my team. You absolutely have to understand what your customer wants. It's the most important thing. And it's a real challenge for engineers because we see the solution to the problem. We can see it in our heads. We can see how it can be manufactured. We know what will fix it. But what we're not very good at is learning how people will interact with it. And we absolutely have to do better with that.
Yeah, customer engagement and interviews always so important. Raoul, the Royal Commission into Mental Health was released earlier this year. There were 65 specific recommendations handed to the Victorian Government. Number 64 reads that the Victorian Government administer a dedicated mental health innovation fund for projects and that provide practical support to services to implement and test new approaches to mental health treatment. How valuable is this to research teams looking to translate their research to have impact, and what does it mean to have this type of support?
Yeah, so I think it means a great deal. I mean, the difficulty, like a lot of the things in those recommendations, will be how you implement this stuff in a way that's flexible enough to be useful. Like you don't want to create another kind of layer of bureaucracy that you then need to kind of go through to access stuff. But equally, you do need that help. And Thumos Health, which was our little startup idea that went through TRAM, partly folded because of the difficulty in launching a product in Australia where the main beneficiary of the product would be government, because it's just so hard to kind of sell to that cohort when the costs are borne so diffusely across different departments and that sort of thing. And just finding someone to, we spoke to a few people within the department who were kind of like, oh, I think that person can help you, or I think we have this thing, this innovation fund or whatever, and even within, I guess within the government, it was hard for them to even know, who they should be, directing people through. So if you're an outsider, it's, doubly difficult. So I think, and one of the models that they picked when describing that, when making that recommendation, only accepts projects sort of once a year. So, for something that I'd wanted to launch over at the Austin, we realized that we were a month out from, or a month past that submission deadline. And, and so to wait another 12 months, who knows if the same people will even be working there, who knows if that idea is even worth doing in that stage, because, the technology's moved on, etc. So just looking at these type of funds that are much more flexible and I guess able to interface with the entrepreneurial world will be crucial, I think.
Similar question to you, Tia. The government has just announced a Royal Commission into veteran suicide, and there have also been calls to increase funding for interventions. How do you think interventions like what VR Core offers could be better supported by government?
Yeah, I think just kind of building on what Rahul said, government's very rigid. It's taken an awfully long time to get them to even do a Royal Commission into veteran suicide. This should have been done decades ago. We've known for a very long time that the suicide rate in veterans is absolutely unacceptable. In terms of support, I would love to see them just engage with startups more readily. There's kind of, obviously there's a focus on working with universities, and I can understand that, but a lot of startups have scientists from universities who have left because they have this great product or this great invention that they want to get into the hands of people who need it. And I feel like those startups, those sort of science-based startups, tend to get overlooked by government. It's really hard just to get a foot in the door to talk to someone. And as well with technology, as I said before, our startup is in the digital therapeutics space. That's a pretty new space that didn't exist a couple of years ago. But if you went into government and mentioned that to anybody, they would have no idea what you're on about. They understand medtech, but medtech could be anything from a kidney dialysis machine to something for mental health. So it really doesn't cover what we're doing. It's far too broad. So yeah, I would love to see them be more flexible. Just have a team that can be on the ground and actually talk to us startups that are science-based to see how we can work with them to reach the milestones that government's trying to reach.
On the note of government, at the last local council elections here in the city of Melbourne, for the first time we had candidates running openly to push support for the innovation sector here in the city. And just last night at the opening of the space here and Melbourne Knowledge Week, we heard from Melbourne City Councillor David Griffiths talking about the value of supporting innovation together hand in hand with education. What do you think the City of Melbourne needs more of, and what's on your wish list to promote more research-led innovation here within the city?
I would like some money, please. That would be really good. Yeah, I think just the same as what I said before about just having more flexibility and being able to have an open conversation with people, government officials, and understand how can we sort of work together in a mutually beneficial manner. Yeah. I just find that's really hard to do at the moment, and it's nearly impossible if you're not part of a university. And VR Core is sort of outside of the university. I did my training here and part of TRAM and stuff, but it's not an university IP held startup, so it's really difficult for us to get a foot in the door and just get FaceTime with people. So just that conversations would be amazing. That and money and food and drinks, spoken like a true entrepreneur. That would be perfect. Thank you. To the rest of the panel, what else can the City of Melbourne be doing to support more research-led innovation?
Well, I think that's the future. It's what's going to. It's the future, and hopefully the future of manufacturing in Victoria, I think, is innovative technological manufacturing, both in manufacturing standard products, but also in manufacturing high technology products. I think in order to do that, there's going to have to be some risks taken. And as Tia pointed out, the government tends to be quite conservative, but they're going to have to invest in these startups. You're not going to get high technology, basically high risk, high reward products or a manufacturing sector unless you take those risks in the first place. So I think government interacting with startups is going to be really important. Just on that, when I was working on the hood, one thing that was really missing was a task force that was assessing innovative technologies. There was a task force to find masks and to find ventilators and to find all these things that we know we already needed, but there was no one looking at little startups or people that were coming up with really innovative solutions. So what happened was we just ended up with government spending all this money trying to secure what we already knew, what we already thought would work, but we didn't have any innovative solutions. So I guess that was a microcosm of the problem. Well, it's not very micro, but it it was an example of that problem. If we don't have government or an entity that is going to find these startups, find this exciting technology that's happening around our city, we're going to miss out. We can't afford to miss out.
Yeah, look, I agree. And just having, I mean, we talked earlier about multidisciplinary teams, and I think a whole of government approach is really what we need, because often, you know, the things that organizations need to, or startups need to enable some of these changes can cut across a whole bunch of things. I mean, you know, my wife's a town planner, and even having sort of spaces for manufacturing, I think has been a real problem in a place where everything kind of, all the warehouses are getting converted into apartment blocks and that sort of thing. So, you know, just thinking about how each segment can really contribute to that space would be really useful, as well as, you know, people to, I guess having that one-stop shop where you can pitch ideas on a more agile basis. You know, one of the things that came up in a conversation I had with someone who was working in hotel quarantine was around, you know, could we use all the infotainment systems that people are watching on their way, you know, back to Australia, to actually educate them about COVID and what they should do when they get here, and how hotel quarantine works, and how, you know, infection and, you know, all of those sort of things. I mean, they're just watching movies on the way across. You know, you could probably scrap something together pretty quickly. I'm sure there's some stuff on YouTube, but, you know, just being able to have someone who can champion little ideas and little innovations that are probably going to cost you peanuts, but to be that broker, so that, you know, you're not some random person with an idea, but you know, an innovation team from the City of Melbourne saying, this is a good thing, let's do that.
Some fantastic ideas. I hope Sally Capps tunes in online. Now, the purpose of Melbourne Knowledge Week is to bring Melburnians together to explore and share ideas and challenge each other's assumptions and spark new ways of thinking. So with that in mind, I'm excited to open up to our audience here at Melbourne Connect to join in the conversation. So if you've got a question, please raise your hand nice and high, and we'll see what our panel has to say. So do we have any questions from the audience up the front? I'll jump over and...
All good. I've got a question. You mentioned the TGA before. And the process that was like. Could you talk a little bit more about that? I mean, were they too slow during a pandemic to relax some of their approval processes? Or could they have been faster? You know, or is it about right, you think?
I think the TGA was, in my experience, was really good. They did a really good job of pivoting. There were lots of other things that were too slow, but the TGA was very good. What the problem was that nobody knew how to interact with a fast TGA. Everybody was so used to an 18-month process. Well, maybe that's a bit of an exaggeration, but everyone was so used to a slow process and going through that they didn't know, what do we do with a 24-hour turnaround? What documentation is required? Does my device fit in with these rules? How do I know? That's exactly what happened to us. So if we were making a new mask, we knew what would happen. We could just deliver a very short document and TGA would have ticked it off and said, yeah, it's fine. But we had something that wasn't quite that. It could interact with patients. It wasn't clear whether it was just PPE or whether it was a medical device. So how do you get advice quickly from an industry that is used to giving advice over a 3-month period? And that's what we found a real problem. We actually couldn't find out whether we could put our device, what documentation we needed to get through the TGA quickly. It took us about 2 months to figure that out, figure out what we had to do, and we had approval in, I don't know, 48 hours or something like that. But during that 2-month process, of course, we had a lot of the documentation together that we required. The manufacturer geared up for 13485 certification. So, yeah, I would say there was a whole lot of other processes around that were too slow. The government being able to advise, for example, didn't exist because they didn't know how the TGA was operating either. So nobody really knew how the system was operating. More communication between the TGA and other entities would have been really helpful. But then again, could you ever do that really quickly? I mean, it was unprecedented times to be able to communicate something that's so important as the safety of a device that you're putting in contact with a person. To do that quickly without cutting corners, without creating risk, that's a balancing act that you can't necessarily do fast. But I think they did a good job.
Great question. Any further questions from the audience? I'll just repeat it so our friends at home can hear.
Yes, my name is Fred Sam, a retired public health doctor and epidemiologist. And a comment for your comments. I've worked in emergencies and I've found that change is much easier during an emergency. And I think the issue of timing becomes very important. And I remember a TED talk saying the most important thing about a successful business is timing. So would you make a comment about that? The second thing is lateral thinking in terms not only of skill, but of mindset and of knowledge. And not only of those three things, but lateral thinking in terms of the whole area of times, so everything you can think of, think in terms of a matrix. That's the way I see it. Anyway, I'd like your comments.
So for those listening at home, the question was about the timing of how these things happen and the impact of things like lateral thinking and I guess going around certain problems as well.
Yeah, so to start off with the timing one, yeah, it's an odd thing because you almost feel like you're profiting off of people's poor mental health. But obviously, yeah, with COVID, this discussion that should have been had a long time ago is suddenly, we're starting to have it more. People are starting to talk about loneliness and just feeling lonely and their depression. We're starting to see people who have mental illnesses and mental health disorders who are starting to say, hey, yeah, they're starting to flare up again because of this situation. So I think COVID for us has definitely brought the conversation back up. And then, of course, with the Royal Commission into veterans' suicides, I mean, it's an unfortunate truth that these things need to have a lot of media coverage before people start to take them seriously. And so all we can do is try and jump at that chance and just get people to listen to us because it looks bad for them if they don't. And it's not a very nice factor of humanity that we have to wait until that happens. But I think in mental health, that's certainly been true for VR core anyway.
So a quick factoid is that the first government white paper saying that telehealth would be perfect for Australia and its needs was written in 1993. So it took, decades and a pandemic to get the right timing for mass adoption, but, the ideas were there.
Yeah, well, certainly for us, I mean, timing was everything. If we had been asked to look at this even a couple of months, in terms of the hood that I'm talking about, a couple of months before, our lab was running full blast trying to do defence projects. So I probably wouldn't have taken the call. In terms of lateral thinking, I think if you're expecting one person to think laterally to solve a problem, then there might be a few Steve Jobs and other such successful people in the world, but there's only going to ever be a few of them. Your lateral thinking is going to come from getting together with the right team and being open to their thinking. And that's where you need people with different ways of thinking. And the challenge there, of course, is that working with people with different ways of thinking is really hard. You need a lot of patience and you need a lot of forgiveness in some cases. But certainly you need to give people the latitude to be able to contribute their different ways of thinking.
Another question from the audience up the front.
Yeah, I'm curious, Jason. I'm actually from Western Health. I'm declaring my interest in. But with the hood and the process that led to that, given especially that it was so fast, and you basically sort of abandoned the other work you were doing to turn your attention to that, and you got a whole lot of people together who you hadn't worked with before, who were subject matter experts. How was that process sort of project managed in terms of when to meet, when to test, when to brainstorm, when to go apart, when to get... How was that actually all managed across the process? Did you have to meet every week or every second day to say, this week we're going to do this or tomorrow we're going to do that? How did you get everybody to work in that group for that period of time?
So the question was, first of all, another fantastic plug for Western Health. And then relating to the process of how the hood was designed, a question about the project management and the kind of the nitty-gritty of how did it actually come about and what the process was going through that. Jason?
Yeah, I'm trying to think back. It was such a blur. It happened so quickly. It really did feel like a wartime effort. I mean, in hindsight, as Rahul mentioned, we probably ended up a lot better off than many countries, so we didn't end up having the war as such that other countries had, but it felt like it was coming. So that was kind of the response that we went into. It was in a sense militant. Everything had to be planned. I had quickly got team leaders for each different area. And we would have regular meetings. So every morning we had like a war room meeting with the core team, where we would just list all the things that we had to get done by whatever the next prototype deliverable was. And then we would have regular meetings with the manufacturing team and regular meetings with the business development team that was trying to negotiate the TGA issues at the time. There wasn't a lot of sleeping. It was consuming. It was all consuming. But you had to be methodical. And we were really determined. I think what we were saying was we don't want to be sitting around at the pub in 3 months' time saying, why didn't somebody just come up with this? Why didn't they? We could have done this, you know, if we just had the money or if we just had the time. So we just put our heads down and made sure that we were methodical, that things happened on time, and that there were no loose ends. So there was a lot of documenting what we were doing. Yeah, it was surprisingly methodical because we're not used to doing that. We get a research contract, we have to build something and get a couple of students working on it, and 6 months later we'll write a report on that. And what happens in between is just day to day. So we weren't used to that kind of process. But we knew it had to be done, or it wasn't going to get finished.
In researching tonight, I read a lot of the articles that were written about the hood, and there were lots of images of lots of whiteboards covered in scrawls of lists of to-do and new ideas and all sorts of things. That almost brings us to the end. A final 10 seconds for each of you. What comes next now?
So we are building our technology with an aim to have it ready to go by the end of this year, fully trialled and ready to help veterans.
Fantastic.
We're now looking at ventilation in indoor spaces, trying to improve ventilation for infection control.
And I'm looking at how Phoenix can be one of those people that subject matter experts that entrepreneurs and things can come to for advice and input.
Well, thank you very much. That brings us to the end of our formalities, but the exciting part is that this is just the beginning of the conversation. Personally, I'm inspired by what happens when we get great people with brilliant minds and they're given the permission to dream, do and explore. And I look forward to seeing at next year's event what amazing things our researchers have accomplished. So can you please join me in showing our appreciation of our panel tonight? Thanks very much to everyone who's taken the time to join us out here in the Melbourne Connect, the new precinct here in the city of Melbourne. Thanks for taking the time to join us here. Thank you for everyone who's logged on at home. Please enjoy the rest of your evening. Thank you.